Hey guys, it's Dr. Hobbins from Hobbins Medical Direct Primary Care coming to you today with another patient education video. So we're halfway through the month of January. It's been a busy month, so only today did I recall and realize that January is Thyroid Disease Awareness Month. So the thyroid gland is a very small but important gland. It's located in the front of the neck. It's only several centimeters in size, but as you'll see as we kind of go through our conversation today, it's a really important endocrine gland that regulates a lot of different processes in your body, and there's a lot of different things that can go wrong with it. So really thyroid disease encompasses primarily an overactive thyroid gland, an underactive thyroid gland. There are certain benign conditions like benign nodules and cysts, and then the thyroid gland can also form several different types of cancer. So today we're really going to focus on how the thyroid gland functions and what it does, and let you know from a primary care perspective there's a couple easy things to do. So number one, all patients when they have their annual physical should have an examination of their thyroid gland. It takes almost no time. It's easy to do. It's a small gland at the base of the neck, and I'm just going to kind of demonstrate. It's located actually right above your collarbones in the midline. And to examine the gland, you just press and feel with your fingertips, and you're feeling for any enlargement, swelling, firmness. And actually it's important that your doctor asks you to swallow during that point in the exam. We'll raise the gland up above the back of the collarbones, and we'll allow your doctor to feel the isthmus, the little connecting portion of the horseshoe-shaped gland in your neck. So that's really all the examination portion is. If by chance it's felt to be abnormal or enlarged, or something doesn't feel quite right, it can be assessed further with typically an ultrasound, okay? And then we'll talk about the thyroid blood test. Those are the two main ways that we assess the thyroid gland in primary care. The exam and an ultrasound if necessary, and then the routine lab work. So the most common type of thyroid problem that we encounter in primary care is hypothyroidism, or an underactive thyroid gland. Some of the common symptoms of that are feeling cold all the time, or what we call cold intolerance. So if you feel like you can't warm up, or you're constantly layering up with coats and blankets and everyone else is in shorts and t-shirts, that can be a sign of an underactive thyroid gland. Constipation, fatigue, weight gain, all kind of signs of a slowing metabolism. Your thyroid plays an important part in regulating your metabolism. And then dry or brittle hair, skin, and nails. A reduction in mood, so low energy, low motivation, just not having a lot of gumption or get up and go can be part of an underactive thyroid gland, as well as menstrual changes in women. The blood tests that we typically do to assess for an underactive thyroid gland are TSH and a free T4. They're two simple, should be inexpensive blood tests, and it tells us a lot about how your thyroid gland is functioning, whether it's normal, overactive, or underactive. Quickly, I'll just share about hyperthyroidism, overactive thyroid gland. By comparison, this is much less common than underactive thyroid. The symptoms of this include weight loss, palpitations, which can be a funny beat to your heart, or feeling like your heart is beating rapidly, or skipping, or thumping, or pounding, increased blood pressure. Opposite of what happens in hypothyroidism, you can have diarrhea or loose stools. Bug eyes or bulging eyes can be a symptom associated with a overactive thyroid gland. Tremor or shaking, feeling hot and sweaty as opposed to cold, and then actual muscular weakness and even fatigue can go with this, especially when you are trying to use your body. You're just going to feel very drained if you have a very overactive thyroid gland. So in discussing the thyroid gland, it does play a role. The hormones the thyroid gland produces play a role in regulating your vital functions like your breathing and your heart rate. It also is a key regulator of your weight and metabolism, helps regulate your body temperature, and has an important role in energy production, so how much energy you feel. And actually thyroid is also connected to your cholesterol. And truthfully, there's more. These are just some of the high points. So briefly, I just want to explain how it works, and that will help you understand how, when something goes wrong, why does that happen and how can you correct it. So this is your brain, and at the base of the brain you have the hypothalamus gland, and just beneath that you have a small gland called the pituitary gland. the pituitary gland is constantly sampling different levels of hormones in your body. And in the case of thyroid hormone, when it feels like there is not enough thyroid hormone in the body, it will produce TSH, which is thyroid stimulating hormone. This acts like an on switch for your thyroid gland, which will then produce free thyroxine, or T4, and that acts like an off switch at the pituitary and says, okay, you told me you needed more, I made you more, and now stop making so much TSH. So here's how things can go wrong. If we find that the TSH is high, that's your brain telling your body, I want more thyroid hormone. Many times your thyroid will respond by saying, you know what, brain, we're actually in the normal range, we're making just enough, so we're just going to ignore you. And that is a condition that can be known as subclinical hypothyroidism. What we also see is where the free T4 level comes back low. And that is your thyroid gland saying, okay, you want me to make more hormone, but I'm very sorry, I can't do it. Something is wrong, okay? And that will prompt your doctor to find out more about why you have an underactive thyroid. And the most common cause of that is autoimmune thyroid disease. It's also known as Hashimoto's disease. It's kind of a long, fancy name, but it describes a very common condition. And there are 2 inexpensive blood tests that help us discover if that's the cause of your underactive thyroid gland. And those are called thyroperoxidase antibody and thyroglobulin antibody. Alternatively, if you have a low TSH, that's your brain saying, whoa, what are you doing down there? You're making too much thyroid hormone, knock it off. And if your free T4 comes back high, that's your thyroid gland saying, yeah, you're right, something's going haywire here, and we can't stop making so much. That is called hyperthyroidism, and there are various causes for that, but one of the common causes for that is called Graves' disease. It's a condition where a different type of antibody stimulates the thyroid gland to produce hormone without there's no brakes on that system, and then you'll wind up with these symptoms. Some things you can do to support a healthy thyroid gland is make sure that you are getting enough iodine in your diet. There's been a move towards sea salt with cooking, and it is delicious. It has some of its own health benefits in moderation, but a lot of us are missing iodine because we no longer use iodized salt. So you may make a point to do some of your cooking with small amounts of iodized salt. Foods that are rich in iodine include kelp, seaweed, greens, fish and shellfish, strawberries, and I will add on to this nuts like almonds and beans and lentils as well. Also, really, your thyroid gland, like most of the organs in your body, respond well to just good general health. So the general health principles that help support your thyroid gland are getting enough sleep, getting regular exercise, and here you want to be careful that you don't overtrain. That can actually be harmful to the thyroid gland if you're overdoing things. Managing your stress, keeping your stress under control, and when you know that it's mounting, doing something to help reduce your stress, and then eating a healthy diet. So that's a brief introduction to some of the common conditions we see in primary care. The important points are have your thyroid gland examined, do it yourself. If something doesn't feel right, it can be checked out further. You'll notice on the diagram I included roughly what the appearance of a thyroid cyst would appear as, and also nodules, which are common things that occur on the thyroid gland. Sometimes the entire gland will become enlarged when there is an episode of hyperthyroidism or hypothyroidism, so maybe just the entire gland is too large. So have it checked, do the basic blood tests that go along with this. It does not take long to do an exam at home. Your doctor can help you with the next steps. I hope you found this helpful. If you have any questions, drop them in the chat section below, and we'll see you next time. We do take requests for other topics as well, so if there's a topic you'd like to see covered, please list it below and we'll try to cover it in one of our future videos. Thank you so much. If you're interested in learning more about direct primary care, you can check out our webpage at hobbinsmedical.com. Thank you.